Why are we here? Well, really at the core of this is both the desire within the NHS, within local government, with the voluntary sector and national government, really to try and create the structures that will work for integration, but that can also think about population health.
I was sitting there thinking about what are we trying to do here? And it sounds easy to say that we're here for the patients and the citizens. What we need to do is to get below that, we disaggregate that and really understand what it is specifically we're going to do. We can't do everything, but we need to set ourselves on the trajectory, and we need to understand what it is our role, our personal role, and the organisation to which we belong for pay and rations role. And it was interesting for me to hear Richard say about light touch in the bill. Well, light touch is only going to work if we trust each other. And we will only trust each other if we know each other. And we will know each other if we really fessed up to some really difficult decisions, which might impact us personally, actually.
I think it's really important that system leaders get together to share ideas about collaboration and, more importantly, what we can do together to improve local health populations. The aim for me is about how ordinary people in the street get better access to support and healthcare when they need it. And every conversation that we have should be about how we support more people and treat less.
It's about our teams, it's about our staff, and it's about our local people, and actually we need to use them to drive this forward. And how do we create the space to make sure we're listening to local people, listening to our teams and talking to them, and finding a way of doing the today and the tomorrow piece of work, because I think that's going to be really important for all of us.
Well, our patients suffer from disintegrated, segregated care. They have suffered for a long time because the bits of the jigsaws, the pieces are there, but the pieces are not put together. But now, if we put all the jigsaws together, it's one picture.
I think today's a really important opportunity for us in South West London, that is health and social care. Well, local government generally, I think, and the voluntary sector, because it's an opportunity for us to practice in a safe place some of the things we're going to actually have to do once the ICS is properly established, and all the expectations that will be upon us. And I feel stronger as a result of some of the conversations that have already happened today.
London's a very complex environment. It's not straight linear lines, nice and tidy arrangements, and yet we somehow seem to be a little bit ahead from other places. We've got a good mix of skills and relationships, and we are getting on with it.
What the ICS means for my staff is that we've pulled down the walls of our organisation so we can work more collectively and collaboratively to treat our patients, and also that our staff actually get to know far more about what's going on and are able to more freely innovate and to actually do things differently. What we do is actually only a part of a microcosm of the system, and actually how we work together will really tell in how well the health and well-being of the people we serve actually is.
I think the most important thing that I take away from today is the conversation, and I've had a fantastic opportunity to have some great conversations with some colleagues who I don't normally speak to in the system, and I think that's the basis for building trust. So conversations lead to trust, trust leads to relationship, and ultimately that leads to cohesion and togetherness, and that hopefully enables us to redesign a system, but also gives us the ability to work with our communities to make health and well-being a reality for so many of our residents.
I think in South West London we've actually had a very good foundation with the relationships that we've developed with our health and care leaders, and bringing them together today creates a way of being able to tackle some thorny issues and come up with some real solutions to scenarios that may well come along in the future.
What I'm really impressed with today is that, yes, we've got the provider side, the big hospitals, community services, mental health trusts, but we've got GPs around the table. We've got our colleagues in local government who are increasingly important, and we've got some of our colleagues from the third sector. And as we move forward, that's where a major opportunity for the future for South West London lies.
I think health can be seen as a top-down process, and I think the very reassuring thing about today is that it's more bottom-up. It's more about residents, their needs, how the different parts of the system, as it's called, which is all the organisations, work better together.
Today is very important for South West London because as we build in and start planning to move into the formation of the integrated care system, it's really important that we all come together to start doing the thinking together. So that will give us a sense of joint ownership rather than actually the system feeling that people are doing it to them, but rather we are all doing it together and starting from the beginning together.
For me, it feels like the start of a journey, some real positives and some really good outcomes, but perhaps there's more to come in this psychological safety space.
What we've done today is think about the problems that are facing us and think about how we actually create solutions that will make a real difference for the future. One of the things that we've committed to do is to actually build in time in the way we work and into our weekly structure to not just think about today's problems, but to come together to talk about tomorrow's problems and lasting solutions.
I have learnt so much today about the possibilities of positive change and how different parts could work together.
Our relationships are very strong, but they need to be very strong at the critical moments when there's some tension and some disagreements, because lots of the time we actually are largely agreeing with ourselves, which is great, but not all the time, and when we don't, that's what we need to test ourselves on.
So my takeaway from today is that actually there's a real strength in South West London, that actually the people that work in South West London really want to make this work for us and for our local people. And actually we just need to build. We talk about going from good to great, and I do believe that South West London, we can be great.
I think the most important set of takeaways for me is how do we actually capture this energy and this commitment, and how do we turn that into actions, and how do we make that happen, because we do need to take some actions. There's short-term, long-term, medium-term things that we will have to do, and for me, and you probably expect me to say this, the ICS is not in April next year, it's here, it's now.